Phlebotomy Certification Practice Exam. Question 1. A serum or plasma specimen containing abnormally increased fatty substances, animal or vegetable origin, is described as lipemic, anemic, eccentric, hemolyzed. Lipemia refers to the presence of excess lipids in the blood, giving serum or plasma a milky or turbid appearance. Lipemia can result from recent food intake, metabolic disorders, or underlying conditions such as diabetes, and interferes with many laboratory tests by scattering light in spectrophotometric assays. Question 2. When palpating a vein, having which of the following characteristics would be most appropriate to select for venipuncture? Hard, bouncy, thin, pulsating. A bouncy, resilient vein with good turgor is ideal for venipuncture because it will not collapse easily and provides adequate blood flow. Hard or cord-like veins suggest sclerosis, thin veins are prone to collapse, and pulsating indicates an artery, which must never be used for routine venipuncture due to higher pressure and complication risk. Question 3. The phlebotomist has to prepare a blood smear for a leukocyte alkaline phosphatase (LAP) test. What is the correct procedure? Perform skin puncture and touch slide to first drop of blood. Perform skin puncture and smear with first drop of blood. Perform skin puncture, wipe away first drop, and touch slide to next drop. Perform skin puncture, wipe first drop, place large drop on slide, and cover with slip. The first drop of blood from a capillary puncture should be wiped away because it contains tissue fluid that can dilute the specimen and alter test results. The second or third drop should be used to create a thin, even smear for accurate LAP scoring, which helps differentiate chronic myelogenous leukemia from other leukocyte disorders. Question 4. Which of the following techniques is best to employ if blood is not obtained upon needle insertion? Gently advance or gently pull back slightly. Discontinue. Redirect the needle to the side. Remove the needle and call a doctor. If blood does not flow after needle insertion, the bevel may be against the vein wall or only partially inserted. Gently advancing or pulling back slightly can reposition the bevel into the vein lumen. Excessive redirection should be avoided as it increases patient discomfort and hematoma risk. Question 5. You have properly prepared the antecubital venipuncture site, selected the correct collection device, and entered the vein at a 20 degrees angle. Is this the proper angle of insertion? No, 10 degrees is correct. No, 30 degrees is correct. No, 45 degrees is correct. No, 90 degrees is correct. The recommended needle insertion angle for routine venipuncture in the antecubital fossa is 30 degrees, not 20 degrees. A 30 degrees angle allows smooth entry into the vein while minimizing the risk of passing through the posterior vein wall. Steeper angles increase the risk of penetrating both vein walls, causing hematoma. Question 6. Which substance has a higher concentration in capillary blood than in venous blood? Potassium, calcium, total protein, glucose. Glucose concentration is typically 5 to 10% higher in capillary blood than venous blood because capillary blood reflects arterialized blood that has not undergone tissue glucose extraction. This difference is why glucose meter results from finger sticks are not directly interchangeable with venous glucose results, and reference ranges may differ by specimen type. Question 7. Prior to bandaging the puncture site, the phlebotomist should thank the patient, instruct a fasting patient to eat, examine the site for bleeding, apply pressure for at least 5 minutes. Before applying a bandage, the phlebotomist must examine the venipuncture site to confirm that bleeding has completely stopped. If bleeding continues, additional pressure should be applied before bandaging. Applying a bandage while the site is still bleeding can cause hematoma formation under the bandage. Question 8. A skin puncture is preferred over a venipuncture when the patient is severely dehydrated, has chronic poor circulation, is extremely cold, has severe burns. Skin puncture is preferred for patients with severe burns because finding intact veins for venipuncture is difficult, and venipuncture through burned skin carries high infection risk and is extremely painful. Capillary puncture using an alternate site provides sufficient blood for many tests while avoiding these complications. Question 9. Older patients are more prone to hematoma formation because they have smaller veins. Tourniquets must be tied tighter. Their veins have decreased elasticity. They have difficulty making a fist. Aging causes loss of vein elasticity and thinning of vein walls, venous fragility, making older patients' veins more susceptible to rupture during needle insertion. Phlebotomists should use smaller gauge needles, apply gentle tourniquet pressure, and avoid excessive probing when drawing blood from elderly patients. Question 10. Why is it necessary to wipe the first drop of blood away when performing a capillary procedure? To help increase blood flow. To eliminate alcohol contamination. To reduce tissue fluid contamination. To decrease pain. The first drop of blood from a capillary puncture contains tissue fluid, interstitial fluid, released when the skin is punctured. This tissue fluid can dilute the blood specimen and alter test results, particularly affecting glucose and electrolyte measurements. Wiping away the first drop removes this contaminated fluid. Question 11. A serum or plasma specimen from a patient with severe lipemia would visibly appear clear, eccentric, milky, yellow. Severe lipemia, elevated triglycerides, causes serum or plasma to appear milky, turbid, or creamy as lipid particles scatter light. Lipemic specimens interfere with many laboratory tests that rely on spectrophotometry, including chemistries and coagulation assays, and may require ultracentrifugation or special processing for accurate results. Question 12. When performing a capillary blood collection, the first blood drop is wiped away because it helps to visualize the puncture site. You can tell where to place the capillary tube. The first drop may clot faster. The first drop typically has more tissue fluid. The first drop of capillary blood has a higher concentration of tissue fluid, interstitial fluid, because it is released from damaged cells and lymphatics during the skin puncture. This tissue fluid dilutes the blood specimen, potentially causing falsely low results. Wiping away the first drop allows collection of subsequent drops consisting of pure capillary blood. Question 13. Which of the following is an accurate statement regarding the handling of specimens? Protect light-sensitive specimens for bilirubin. Concentration may decrease up to 25% after 5 hours. Blood smears made from EDTA specimens must be prepared within 1 hour of collection. Chilling specimens speeds up metabolic processes and destroys analytes. EDTA specimens for ESR must be analyzed within the first hour of collection. Blood smears prepared from EDTA specimens must be made within 1 hour of collection because prolonged storage causes morphological changes to white blood cells, making differential interpretation inaccurate. After 1 hour, granulocytes may show degenerative changes that interfere with accurate cell identification. Question 14. An anticoagulant is used when collecting a sample for a blood glucose test because of its ability to inhibit glycolysis. What color stopper would be found on an evacuated blood collection tube used for this purpose? Blue top, yellow top, red top, light gray top. Light gray top tubes contain sodium fluoride, glycolysis inhibitor, and potassium oxalate, anticoagulant. The fluoride prevents red blood cells from metabolizing glucose during transport and storage. Without fluoride, glucose levels can decrease significantly, leading to falsely low results. These tubes are used for glucose and lactate testing. Question 15. The phlebotomist has a patient who has no known allergies. In preparing the puncture site, the phlebotomist uses iodine to clean the site. Is this the best antiseptic to use for routine venipuncture on a patient with no known allergies? Yes, iodine is the best antiseptic. No, should use 5.25% sodium hypochlorite. No, should use 70% isopropyl alcohol. No, should use hydrogen peroxide. For routine venipuncture on patients without allergies, 70% isopropyl alcohol is the standard antiseptic. It is effective against most bacteria, dries quickly, 30 seconds, and does not interfere with test results. Iodine is more appropriate for blood cultures when a higher level of antisepsis is required. Question 16. Which of the following is not mandated to be on a label of a blood specimen collected for blood transfusion testing? Patient's phone number, patient's full name, patient's date of birth, phlebotomist's initials. Blood bank specimen labels require specific identifiers, patient's full name, date of birth, medical record number, collection date and time, and phlebotomist's initials. Patient phone number is not a required identifier because it can change and is not reliable. Proper labeling is critical to prevent transfusion reactions from misidentified blood. Question 17. What is the preferred method for infant blood collection? Cut down, evacuated, winged, capillary. Capillary puncture, heel stick, is the preferred method for blood collection in infants under 12 months due to difficulty accessing infant veins and the small blood volume required. Heel stick should be performed on the lateral or medial plantar surface, avoiding the posterior curvature to prevent injury to the calcaneus bone. Warming the heel for 3 to 5 minutes increases blood flow. Question 18. If the plunger on the syringe is pulled back too fast, the patient will feel a stinging sensation. Specimen may be hemolyzed. Patient will develop a hematoma. Vein will collapse. Pulling the plunger back too quickly creates excessive negative pressure that can collapse the vein and cause red blood cells to rupture, hemolysis, as they are forced through the needle lumen under high pressure. The plunger should be withdrawn slowly and steadily to maintain consistent flow and minimize mechanical stress on blood cells. Question 19. A fully stocked phlebotomy tray readily accessible to the phlebotomy technician while performing venipuncture should include which of the following? Needles of various sizes, needle holder/adapter, evacuated blood collection tubes. All of the above. A properly stocked phlebotomy tray should contain all necessary supplies for blood collection, various needle sizes, needle holders, evacuated tubes of all colors, tourniquets, alcohol wipes, gauze, bandages, and safety devices. Having all supplies readily accessible ensures efficient workflow and patient safety, with supplies checked before each shift and restocked as needed. Question 20. The heel is the recommended site for collection of capillary puncture specimens on infants. The phlebotomist is going to stick the posterior curvature of the heel. Is this correct? No, medial plantar surface is best to prevent bone damage. No, central plantar surface is better. No, anterior curvature is preferred. No, great toe is the best choice. The medial and lateral plantar surfaces, sides, of the heel are the recommended sites for infant heel sticks because they are away from the calcaneus bone. Puncturing the posterior curvature risks hitting the heel bone, which can cause osteomyelitis, bone infection, or calcaneal injury. The puncture should be no deeper than 2.0 mm.